Hi, my name is Dr. Adrian Daryl Sulindro. I'm an interventional pain doctor and a physical medicine and rehabilitation doctor here at Southern California Orthopedics Institute. I specialize in non-operative interventional pain treatments to help patients with spine and low back pain. I also specialize in chronic pain and neuromodulation to help patients with severe pain treat their pain with different techniques such as spinal cord stimulation and mini implantable devices.
What types of patients are good candidates for interventional spine or joint care?
Patients that are good candidates for interventional spine and joint care are patients that have already done extensive course of physical therapy to address their pain. However, they have not gotten full improvement. In these cases, oftentimes we jump in as interventional pain doctors to help patients undergo different procedures and help diagnose the condition to hopefully avoid surgery and get them back to their daily activities. Sometimes patients are also candidates for surgery, but for varying reasons, they do not want to go forward with the surgery or they do not want to do the surgery at this time. So sometimes the treatments that we can do can give them some temporary relief until they're ready to move ahead with surgery.
How do epidural steroid injections help relieve chronic back pain?
Epidural injections is a very common technique that we use to help patients with low back pain with radiating pain down the leg. Oftentimes there's irritation of the nerve roots in the spine, and the irritation causes pain that goes from your back and your leg, often called sciatica. If this does not get better with physical therapy and anti-inflammatory medications, sometimes an epidural injection may be helpful in reducing the inflammation down your back and leg, reducing the amount of your pain, and allowing you to do more physical therapy to get you back to doing what you love and function.
What is a nerve block and when is it used?
A nerve block is a technique to help us aid in diagnosis of where your pain is coming from. So a nerve block is just a simple image-guided injection where we deposit a small amount of local anesthetic such as lidocaine or bupivacaine. The goal of a nerve block is primarily diagnostic. If we block the correct nerve that feels pain, then we can make a diagnosis that that's where your pain is coming from. The nerve blocks are often set up as a diagnostic test, and then another nerve block may be helpful in seeing how much relief you get from the nerve block to aid us in future treatments such as a radio frequency ablation or a rhizotomy, which is where we can actually burn off the nerve and shut the nerve down for a long period of time, such as a year to a year and a half, and help improve your pain.
Can you explain spinal cord stimulation and how it works?
Spinal cord stimulation is a technique of neuromodulation where we use electricity in a device to help treat the body. So other examples of neuromodulation are pacemakers or deep brain stimulators for Parkinson's. In the case of spinal cord stimulator, it's a medical device where little leads are placed into your spinal canal and your epidural space, and a battery is attached where it stimulates the spinal cord to help with pain. Usually this is very helpful in cases of a lot of nerve pain. So for example, a lot of back and leg pain, and the leg pain is primarily nerve type pain, it can really reduce that pain by changing the signals of the pain before it hits your brain. So it changes it into a non-painful or non-irritating stimulus. Oftentimes we do these procedures in patients who have had back surgery and unfortunately continue to have a lot of back and leg pain. And we also do this procedure in patients who, for whatever reason, are not good candidates for a big surgery. It's usually a minor surgery, takes about an hour. And the nice thing about spinal cord stimulation is there's a trial phase. So you get to test it out before you buy it, just like buying a car.
What are the risks and benefits of non-surgical pain management options?
There's obviously a lot of benefits for non-surgical pain management options. The number one is sometimes you are just not the right candidate for surgery. Oftentimes you're either too young, you're too old, or you're too medically compromised. The other thing is sometimes your pathology or your cause of pain is not quite ready for surgery. So if you undergo surgery too early, this may lead to future reoperations in the future. However, on the flip side, if you are a good candidate for surgery, oftentimes that is the better, more definite fix. Because oftentimes if you avoid surgery for too long, sometimes, for example, the nerves can be compressed for so long that it causes more permanent nerve damage. So I think there's a fine line between non-operative pain management, such as doing just physical therapy and injections, and you have to decide when and what time you are a good candidate for surgery. And coming to us, we can help diagnose you if you're a good candidate for surgery or if you're a good candidate for non-operative management.
What should someone consider seeing a PM&R or pain management specialist?
I always like to say that we are kind of like the quarterback or primary care doctor of the spine or pain in general. So if you start having pain that does not respond to simple over-the-counter anti-inflammatories, rest, and physical therapy, I urge you to seek care from one of our PM&R or pain management specialists. We don't try to push medications. We don't try to push injections. Our main goal is to help diagnose the main cause of your discomfort and then help kind of guide your process, whether or not it's just doing more physical therapy, whether it's not doing injections, or whether it's not it's seeing one of our surgeons that can help treat your condition.